Welcome to the Make a Mental Note podcast, where mental health professionals share information and perspectives that illuminate, educate, and is worthy of a mental note. And now your host, Chris Quarto.
Hi everyone, this is Chris Quarto and welcome again to the Make a Mental Note podcast. Today's mental health tip has to do with rebounding from disappointment. You know, at certain points in our lives, we experience disappointments. Some of them small, others large. Sometimes it's hard to get past disappointments because, we had our hearts set on how we thought things would be or should be, and are left wondering, will I ever get this chance again, or is this really how it's got to be? Whatever the case, there are some things that you can do that might help. And I think, first it's important to experience and understand the disappointment. Disappointment is part of being human. So as much as it stinks to feel this way, at least acknowledge how you feel and see if you can figure out what was it about the situation that made you feel this way and what it means to you. Now, beyond that, maybe you can do some deep breathing or prayer or meditation to lessen the intensity of the disappointment. Or maybe you need to distract yourself so you're not dwelling too much on the negative feelings. And, I like to do that by listening to music, but, you'll obviously have your own forms of distraction. Or perhaps there's someone you can talk to about how you're feeling. There's something to be said for sharing emotions with someone who understands and empathizes with what you're going through. Your disappointment won't magically disappear, but that human connection zaps disappointment of its power. Another thing you can do is just, keep things in perspective. Just because something didn't go your way this time doesn't mean it won't the next time around, or that it should have worked out the way you wanted it to in the first place. And, maybe because you had unrealistic expectations. In either case, the thing to ask yourself is, what did I learn about myself or other aspects of this situation that'll help me in the future? Finally, try to find opportunities in disappointing outcomes. Maybe you didn't get a job that you really wanted, but maybe that'll open up some opportunities for you that you weren't aware of or didn't consider or didn't consider seriously. That'll make you more competitive for another job that opens in the future. And maybe that job isn't the type of job that's even on your radar screen right now. So the point is to be open to how a negative could turn into a positive in the future. So that's my mental health tip for today. Okay, today's podcast interview is with Jennifer Taylor, and here is Jennifer. Hi, everyone. Welcome again to the Make a Mental Note podcast. I am joined today by Jennifer Taylor, who is a licensed clinical social worker and a registered play therapist at Jennifer Taylor Play Therapy Services in Cordova, Tennessee. And welcome to the podcast, Jennifer.
Thank you so much for having me.
So where is Cordova, Tennessee?
Cordova, Tennessee, it's like a suburb of Memphis.
Oh, okay. So you're probably about 4 hours from me. I'm over in Murfreesboro, so take I-40 right over to the Memphis area. Okay. Well, what I do on these podcasts is I like to introduce my guest to the Make a Mental Note-taking audience. So why don't you tell them a little bit about who you are and what you do for a living?
Okay. Well, like you said, my name's Jennifer Taylor. I'm a licensed clinical social worker. I'm also a registered play therapist. I have a private practice here in Memphis, Cordova area. I just recently started. I've been here a little over a year.
All right.
But I've been in the social work field for about 15 years. I started out as a child abuse investigator and then have done a variety of other things, working with adults with developmental disabilities and children with chronic illnesses and all sorts of areas, hospice, in the social work field throughout this time, but focused primarily on working with children and adolescents.
Okay, so you've been in the field for a while. And you mentioned a registered play therapist. Can you tell the audience a little bit about what that is? Because that's a specialization, I believe, if I'm not mistaken.
It is. It's like a credential. So if you are already a licensed mental health professional in your state, then you can apply to the Association for Play Therapy for this additional credential. And basically it requires you to have completed about 150 hours of specialized play therapy training, either from a graduate level program or from continuing education classes out in the community. And then it also requires you to do some supervision with someone who is trained in play therapy as well. And then you submit your information, your application to the Association for Play Therapy, and then they issue your credentials.
I see. Okay. And so we're talking about play therapy. So I imagine that you work with kids of a particular age using this approach. Is that right?
Yeah, typically play therapy works really well for kids like ages 3 to 11, although you can definitely use like art, play therapy, games, sand, all sorts of things with older teenagers and even with adults. But primarily my practice is from about 3 to 11.
Okay. Well, why did you go into the field of social work to begin with, and then why did you kind of steer in the direction of play therapy, Jennifer?
I tried to make a long story into a shortish story.
Okay.
I went into social work specifically because I wanted to make sure that I could get a job to pay off my student loans. And I thought that was a field that had a connection to there are jobs out there for people with this degree. And so that was one reason.
A very practical
but the real reason.
A very practical reason.
It is. It's a practical reason. I was kind of afraid of all the student loan debt, although I guess I didn't realize at the time the pay and the kind of negative reputation that social work has as a low-paying field. But that can be overcome depending on your niche, and play therapy definitely has helped me in that area. But anyway, a lot of the other reason that I had started out in the social work field is truly my mom was kind of a Dateline addict, and she would watch all these awful stories about kids being abused and neglected and caseworkers doing terrible jobs and missing all the things that they were supposed to be paying attention to. And she watched these things constantly. And I think I just, over time, thought, hey, I could do that job and I could do it way better. And then as I kind of got into the field, it led me into really doing clinical work and really helping kids who have been exposed to traumatic events and who really need help processing those things. And it just kind of evolved from there.
So people can help kids in a lot of different ways, either in social work or through the court system. I mean, there are, as teachers, I mean, there are a lot of different ways of helping kids, and you chose the social work route. And so you did that for many years. In fact, you had a lot of different jobs, as you were talking about at the beginning of the podcast, but eventually you kind of segued into play therapy. So why that area?
You know, I went to a continuing education training one day with a person who was a registered play therapist, and everything she said just clicked. And I thought, that's me. That suits my personality. That suits kind of just the way that I like to interact with people, and I need this training, and I need to go and get more. And ever since that training, every training that I've had since that time has just really cemented that idea that this just suits my personality. It just fits with kind of my way of looking at kids in the world, and it works, and it's fun, and I just love it.
Yeah. And when people hear that phrase play therapy, they think, oh, okay, so you just take a kid into your office and you take out a bunch of toys and you just have fun playing games with them. But there's a lot more to it than that, isn't there?
Oh, definitely. I mean, there's an expression, toys should be selected, not collected. So it's not just I happen to have a bunch of toys, but there is a theory and a method behind what toys you have and why you're using them. And it's kind of a misconception that play therapy is always fun, because this is hard work with kids who have been through some really serious and painful stuff. And sometimes their play is not fun. Sometimes it's really sad or really angry, and it's really serious work that they're doing in the therapy office. And
I guess that's what I was going to talk to you about next, Jennifer, is in your work with these kids, maybe you can tell the audience a little bit about the types of kids that you see, that types of problems that they have, and if you find that these kids have similarities in either how they present themselves in play therapy or the types of things that are discussed or processed in the play therapy process.
Absolutely. Well, in the Memphis area, it seems like trauma is the number one thing.
Okay.
Almost every child that I see has been exposed to or involved in some kind of traumatic event. So there's definitely a theme here in this area about that. And then secondary to that, I think, is the oppositional defiance. And that seems to be something that is really common in my office, and kids who are defiant or disruptive in school and at home. And interestingly enough, when they come into the play therapy room, really what I see is a lot of anxiety and lack of confidence and insecurity, and they have difficulty making decisions when they're not being defiant to someone else's orders. So it's really a complex situation.
Mm-hmm. Yeah. So, yeah, and I had heard that too about trauma being one of a big focus of play therapy, but, there are a lot of other things as you're discussing too. So take us through, if you could, just give us some of the basics of a play therapy session of, what it would look like if I were to, be in the room with you doing work with a child. What would I see you doing, or what would I see you saying to the child?
Right. Their play therapy, it can kind of take a couple of different forms. It could be directive. I have an idea for a child and we're going to play a specific game. We're going to do a specific task. Or it can be more non-directive, which is what I typically do, especially to start out with. So non-directive play therapy means that your office is set up with your selection of toys. So you would see aggressive toys and creative toys and real-life toys in my office.
All right.
And essentially, I introduce to the child, this is your play therapy space, and in this room, you can do most of the things that you would like to do.
Okay.
And then leave it open-ended for them to decide what they would choose to play with or what they might not choose to do anything. And then just really follow their lead. And then you spend some time reflecting and tracking what they're doing, how they're feeling, what they're saying, and building a relationship with that child so that you can get to know them and help them to process the things and the feelings that are bringing them in.
Okay. So part of this is, I guess in the way that you approach this, is allowing that flexibility and not quite as structured. And so they're able to take the lead. And as you're doing this work with them, you're making some comments to them or reflecting to them what they're doing. Are you making any interpretations of their play? Does that enter into it or not really?
Not really, not in non-directive play therapy. I might be making some guesses about how I think they're feeling. If they are playing aggressively, I might make a guess, oh, you seem angry or you're angry about that. And the child has the opportunity to correct me. No, I'm not mad.
I see.
I'm this, or no, I'm not. And so those are kind of, hypothetical guesses based on your interaction and your knowledge of the child of what it seems like they're trying to express. They might not be able to verbalize it. And we're helping them to identify and label those emotions as they come out. And sometimes you get it right and sometimes you get it wrong. And then the child's able to reword that experience for you so that way it's more correctly identified.
Mm-hmm. Yeah. Yeah. And as you were talking about that, I was just thinking, as you were talking about guessing, I wonder if there are ever times when you just kind of like cast out a line and just throw out a guess because you're really not sure what the child is thinking or what they're feeling. And so you're just going to say something just to kind of cast out a fishing line just to see how they react to it, to see if you're on base or if you're just kind of totally off target.
A phrase I like to use is I wonder. So along the lines of what you're thinking, sometimes I might say, I wonder what's going on with those, whatever they're playing with. I wonder what would happen if this. And so it kind of allows the child to answer you if they have information, but it doesn't require an answer. And so they might just look at you and go, and you're left still wondering. So then they provide that answer for you, and then you kind of have additional information about what's going on.
Okay. So in the first part of what you're doing with these clients is that you're developing the relationship with them, and I assume that part of this also is helping them feel comfortable with you, and given the traumatic backgrounds that some of these kids have, I guess part of it is allowing them to develop trust in you. Is that part of this as well?
Oh, absolutely. I mean, the relationship is the key to the change for the child. And so creating a space that is safe and but that still has some limits. I mean, they can't paint on the walls or
Right.
throw rocks at me or anything, but essentially they can do most things. But creating that space and creating a relationship where I'm accepting of the child exactly the way that they come, whether they change their behaviors or change anything at all, I'm completely accepting of them just the way that they are. And that environment creates a space where they can kind of test out some new roles, or they could decide to talk about things that might be difficult to talk about in the past, because there's a level of acceptance there that is therapeutic, I guess is the best word.
Okay. So as you're developing the relationship with them and they're starting to trust you, how do you gauge progress? I mean, how do you know if a child through the course of play therapy is making progress? I mean, do you establish goals? I mean, I'm not really familiar with this. And how do you know if they're improving?
All right. Well, non-directive play therapy in its truest sense is kind of like there are definitely goals, but they're not behavior related as far as we're addressing them with the child in each session.
Okay.
I address the goals more with the parents. Parents come up with, here are the things that we're noticing, and then I check in with them from week to week to see, are those behaviors improving or not? And I'll give parents kind of more specific behavioral interventions that they can do at home to work on those things.
Okay.
But as far as the child in the actual session, there is a progression in play therapy where you notice when they first come in, they're kind of just exploring the environment.
Mm-hmm.
They're getting used to the situation. They're not really doing any kind of deep play. They're just kind of touching everything and exploring. And then you notice that they start to really develop some themes of their play. They're doing similar things over and over again, or they're telling stories, or there's information that's coming out in their play that's helping them to work through those issues.
Mm-hmm.
And then as they start to get better, they almost get bored with coming here. They were really excited at the beginning, and they had a lot to do. They knew exactly what they were going to do when they came in, and they would play, up to the last minute. And then as they start getting better, you notice that they almost seem bored. They're going, I don't really know what to do today, or I'm not really sure what to work on, because they've kind of resolved some of those issues. So you can definitely notice like this transition throughout the course of time of how what they're doing changes, and how that theme kind of changes from I'm really working on something to I'm starting to feel empowered and I'm feeling like I've resolved that issue.
Okay. Do you, I was just kind of thinking, do you see any differences in the play among girls as compared to boys? Are there any differences along those lines, Jennifer?
I think sometimes there are. I mean, I think the stereotype is that boys are more aggressive, and that is definitely something that I have seen in my office, is that boys can be much more aggressive in their play and much more loud and noisy and messy and kind of hyperactive and all over the place. And a lot of girls come in looking for approval and waiting for directions and kind of wanting to do things that would make the therapist happy, or they're just anxious about making choices and they're not very confident, and so their play is much more introspective or isolating, withdrawn. They do a lot more arts and crafts and coloring kinds of things initially as they're starting to get more comfortable in the environment.
How often do you have to set limits with the kids because of, I don't want to call it inappropriate behavior, but maybe they don't know boundaries or they're not used to limits? I mean, does that happen very often?
I think it does in subtle ways. There are some kids that we have set very obvious boundaries with often, but the boundaries of when it's time to end the session, when it's time to enter, those kinds of things are set every single day.
Okay.
Even just there's a limit of allowing the child to make the choices when they want you to make all the choices. And so that's kind of a limit that gets set. Taking care of the toys, things that could get broken, or just, structural things that they need to know where things are, what things they're allowed to use. So those boundaries come up. But I would say in general, they're small boundaries. They're not huge things. I don't frequently have children who are hitting me or throwing things or painting on the carpet or any of those kinds of like really insane things.
Right.
Most kids come in with a respect for the office and for me and for the space, and they kind of know this is their place and this is a place they really want to do some work. And so in general, they do a pretty good job, but most kids do need limits and structure, and so there's always those little boundaries that get set throughout each session.
Yeah. So I heard you say earlier that parents are part of this process too. So it's just not you working solely with the child, but I suppose that after you're done working with a child in the play therapy part, then you meet with the parents and talk to them. Why are parents an important part of this process, Jennifer?
I mean, parents are crucial to the process because they spend the most time with the child. That's the most important relationship that the child has. And so they are the expert about the child's history in many cases. They are critical as far as just implementing any plans that we have and getting them to be on board with the process and to follow through with recommendations. And so making sure that they are involved in every step of the process is really critical for the child's success in therapy.
How often do you find that the issues that you're dealing with a child in therapy isn't necessarily trauma related, but may have to do with some sort of dysfunctional family dynamics? Does that happen very often?
It does. And I don't like the word dysfunctional because it has such a negative connotation to it. I think families are trying to do the best that they can with the information and the resources that they have. And sometimes they just don't know any better. And so, but yeah, there are patterns of communication and involvement, discipline, all of those things that come into the room where you go, yeah, this child's definitely struggling, but the parents are struggling too. And if we can get everybody working together, then we can really see a lot of progress in a short period of time.
Exactly. Okay. So you have a child who's coming in to see you, and I'm wondering, we always talk about the recipe for success. I mean, what does it take to get a child who initially comes in to see you at point A to point B, where they've kind of resolved their problem, they're not showing the patterns of behavior that they were in the past, or they don't have those negative feelings anymore? What does it take to get them from that point A to point B using that play therapy approach?
I think it takes some skill by the therapist to trust the process, because sometimes it can feel like something that you want to control, or that you need to be accountable to the parents or to the child or to teachers. And so you really want to kind of hurry it along.
Right.
And to really trust the process and allow it to develop, allow those relationships to develop, and to really learn about the child in order to accomplish those goals. And so not trying to hurry it along and in fear of being accountable to someone else and having to make progress too quickly. That seems to be the biggest hindrance. So if you are trusting of the process, it seems to develop more naturally, and that seems to be the most helpful for me.
Yeah, and I suppose that being trusting of the process depends a lot on your experience and past success, and knowing that this is going to work, and even letting the parents know that this works, but sometimes we just have to be a little patient in allowing things to work as they normally do. So so that's interesting. Well, what are the primary challenges in using this approach? As I'm thinking about it, I'm thinking, you're saying that you use a very non-directive approach, and I'm thinking, well, boy, wouldn't it take forever to see change happen, and you don't know when it's going to happen, kind of like what you're just saying about, trusting the process. But what are some of the primary challenges, Jennifer, that you've seen in your work providing play therapy services?
Right, and that's another kind of stereotype, is that non-directive play therapy takes forever.
Yeah.
And from what I've seen, about 16 to 20 sessions is a good average length of treatment. So it's really not forever. It's just a few months. But some of the challenges are overcoming those stereotypes or misconceptions about play therapy, and parents thinking that, don't let them just play. They have to really be in there working on their problems, or trying to educate people about how therapeutic play therapy is and the process of how it works. So that way you really get them to understand what they're expecting and what's going to happen from the beginning, so that you don't end up, with some problems later on where the parents are ready to remove the child from therapy or change directions because they're not getting what they were expecting to get. So just providing that education about how play therapy works and what the process is one of the biggest challenges.
Yeah. And that's interesting. You mentioned education about the play therapy process, and I wonder, with the parents that you work with, how often do you find yourself just kind of educating them about basic child development?
Pretty often. I mean, there's a lot of There's a lot of differences between where children are today compared to how it was when I grew up or
Yeah.
people of my parents' generation. So there's a lot of differences and there's been a lot of changes, but there's some things that stay the same as far as just appropriate expectations for a 4-year-old or for a 7-year-old. And so just providing some of that education to parents about what is a reasonable amount of time that a child should be able to spend on homework, or what is a reasonable amount of time, times that you should be able to tell them to go do something before they actually follow through with it, those kinds of things. So providing that education definitely helps give parents some perspective on what is normal and what is atypical and what they can be expecting to face as their children age.
Okay. Well, Jennifer, what words of wisdom do you have for parents or teachers, caretakers, whoever it is that's caring for a child, just to help them, some general tips of things that they might be able to do to help them, just coping skills or techniques or strategies that they can use to help their kids if they're hitting a rough spot or need some help in some sort of way. Do you have any, just a tip or two that you might be able to share with the audience?
Well, the two things that I would say are consistency. The more consistent that you can be in just your routine, your schedule, the amount of time that you spend with your child really helps promote that feeling of safety and security and will help settle down a lot of issues that are going on with a child. Mm-hmm. And then the second one is attention. Okay. That's the only thing kids come in here. Every single time I ask them, what is one thing you wish you had more of? And it's always, I wish my mom would play with me, or I wish my dad would be at home to play with me. And so 30 minutes one time a week is all we really ask in play therapy. If you can spend 30 minutes one time a week, unstructured, unplanned, just enjoying quantity time with your child unstructured, then that's really going to help improve that relationship and behavior overall.
Yeah, and it doesn't sound that hard to do, 30 minutes a week, but I think a lot of parents don't really, they kind of overlook that, or they might not feel like they really have the time, but I think it's all about making that a priority, with your child. So that's a good tip.
It really is, and a lot of parents feel like behavior has to improve before we're willing to do those kinds of things. So they'll say things like, well, as soon as his grades are better, then we can work on that. Or as soon as this happens, then we can work on that. And my experience has been that the more that you work on the relationship, the easier it is for those other problems to be resolved.
Exactly. Yeah, I agree with that. Well, Jennifer, how could a potential client or a parent contact you if they're interested in setting up an appointment with you?
Probably the easiest way would be to go to my website, which is jentaylorplaytherapy.com.
All right.
Otherwise, my phone number is 901-579-0242.
Okay. And we'll make sure and put that in the show notes, so if anybody wants to contact you in the future, they can do that. Well, Jennifer, thank you so much for joining us today. This was great learning about play therapy, and I think that a lot of parents who listen to this, who have kids who might benefit from this, may be interested in giving you a call and setting up that appointment. So thanks for joining us.
Thank you for having me. I appreciate it.
Okay, I appreciate Jennifer coming on to the Make a Mental Note podcast today to talk about play therapy. And the thing that I got out of this interview today is play therapy is a way of helping children resolve emotional and behavioral problems by engaging with them in ways that are familiar, that are enjoyable through play. And this isn't to say that play therapy is all fun and games. There are intense emotions that are discussed, not necessarily in direct ways, but in ways that are understandable to kids. And the key is for the therapist to trust the process and not feel like they have to control what happens to bring about some therapeutic outcome, at least with non-directive play therapy. So good food for thought. My question for you is this: what role do parents play in play therapy? Well, Jennifer noted that parents are the experts about their child's history and are usually asked to implement plans or recommendations at home to help the child with their emotional and behavioral issues. And, educating parents about child development and about the play therapy process is important so they know what to expect in terms of just overall development, but specifically in terms of the progress their child is making while they're participating in play therapy. So the play therapist really relies on the parents to be their eyes and ears to be able to gauge progress. So that's good stuff to keep in mind. Okay, if you would like the show notes from today's podcast episode, then please visit my website, chrisquarto.com. And also, I am thinking about starting a Facebook page, a Make a Mental Note Facebook page, so we can start to interact with one another online. It's neat to do these podcast episodes, but man, I sure would like to hear from the listeners, and I'm wondering if you would be interested in that too. So I'm going to have information about that in the near future, so keep a watch for that. Thanks again for listening, and have a great rest of the week.